Great question. Sensory overload can look like a tantrum. Like it can be difficult to tell them apart, right? Tantrums can be learned behavior. That's the other thing, right? Every behavior that you see with children with autism, not all of it is due to the way they process information in their brain. Some of it is learned behavior. And so that's where therapy is so important. Therapy like ABA therapy, right? Where they can work with your child to manage or to improve their responses to things. So, for example, I often hear in my office where a parent is saying their child's trigger is no. Just hearing the word no. Whenever their child hears the word no, it immediately sends them into a tantrum-like behavior, which is where they're throwing themselves on the floor, hitting their heads, or it may just be screaming, yelling. Every child is different, right? But if you're not equipped with the skills or the tools that you need as a parent to be able to redirect that child and to teach the child a better response to the word no, then it becomes a learned behavior, right? Versus sensory overload can be they're in a room full of other kids, like the classroom, and they just need to cover their ears, and they just can't stand it anymore and just escape from the classroom, right? And then that's called elopement, but it's most likely in response to the overload of noise that they can't process, and it's just too loud for them to handle, right? So that's the difference. One is can be a learned behavior, and the other one is as a result of the way their brains are responding to the environment.